Hey everyone, Dr. Richard Lai here with Study Acupuncture with me. So if you are new to Study Acupuncture with me, welcome. My name is Richard. I'm a doctor of physical therapy and I'm an acupuncturist. So my goal here with Study Acupuncture with me is really simple. It's basically just to take the acupuncture topics and subjects that are very complicated to understand and just make them as easy as possible for you to understand. So that way you can feel confident when you're in the clinic and you can feel confident when you're studying for the board exams. So today we're going to talk about a very common thing that happens with our patients and with ourselves, which is lower abdominal pain. So you see that in both the clinic as well as on your exam. And for this topic, we have to do a quick shout out to Real Zay Como, who commented on my YouTube saying, can you basically talk about some TCM patterns that affect the lower abdomen? So I thought about it and I took 3 common ones and I'm going to elaborate on them in this video. Now, what's really important about this topic is that in Chinese medicine, how pain feels to someone and how your patient describes that pain, it tells you a lot about what's going on with them internally. So in TCM, when we talk about the lower abdomen, what we're talking about is the lower jiao or the lower burner. That's where our kidneys are, that's where our urinary bladder is, that's where the intestines, and that's where the uterus is located. Now, when there's pain, when there's distension, when there's discomfort in that general area, there's a lot of possible causes. So it could, for example, be Qi stagnation, it could be blood stasis, it could be cold, it could be dampness, it could be damp heat, it could even be some sort of deficiency type situation, like for example, spleen Qi deficiency, spleen Qi sinking, or even like a kidney yang deficiency. But today, basically, we're going to focus on 3 more common ones that I feel like come up a lot in the clinic and on the board exam. And those are Qi stagnation, blood stasis, and cold. And the reason I chose those 3 is because these are pretty foundational ones. They're easy to spot with your patients, especially when you understand how to differentiate between the 3 of them. But the thing is, they are very common. When you're treating in the clinic, you're going to realize, wow, a lot of people have these 3 things. So these are, again, Qi stagnation, blood stasis, and cold accumulation. So let's start with number 1, which is Qi stagnation. So Qi stagnation in the lower abdomen. This is one of the more common causes where someone is complaining about some lower abdominal discomfort. This especially happens in patients who have a lot of stress or who tend to hold on to their emotions. And another organ that we have to take into consideration here is the liver, because remember, the liver is responsible for the smooth flow of qi. So when our patient's emotions, when our patient is very emotional, like they have a lot of frustration or they're very worried, that starts to build up in their body. What happens to the qi? That flow of qi gets disrupted. Qi is going to start to stagnate. So for pain, how pain is going to feel in our patient is going to be that they're going to say things are distending, things are tight, things are cramping. This pain might even move from place to place, or it might go up and down depending on how stressful they feel. Sometimes they might say, I feel bloated, I feel like there's a pressure buildup inside. It gets worse when I'm stressed, it gets worse when I'm emotional, it has a flare-up. When they say that the pain is moving or it's changing, that's a sign of Qi stagnation, not to be confused with wind, which is roving pain. Sometimes it's in this joint, sometimes it's in this joint. That's roving pain. Now, when we look at their tongue and pulse, the tongue, it might look normal in terms of tongue body color. There might also be some redness on the sides of the tongue, which are the organ indicative areas for the liver. The pulse will usually be wiry, especially in the left middle position. So in terms of treatment principle for this one, we want to soothe the liver, because qi is stagnating and liver is responsible for ensuring the smooth flow of qi. So we want to soothe the liver so that way the qi flow can be smooth again. This will also help us to move qi, which is another treatment principle. And then of course we want to harmonize the lower jiao. Now, some common points that we can use for that are things like liver 3, for example, or Li4 or gallbladder 34. If the patient is complaining of like menstrual cramps, then we can also bring in spleen 6 there, which would be great for that as well. Now, the next one is blood stasis in the lower abdomen. And this actually has to do with some qi stagnation, because when qi stagnates for a long time, that can actually start to affect blood circulation because, remember, Qi moves blood. Qi is the commander of blood. So if Qi is stuck, then blood isn't going to move properly either. So this is where pain is going to present differently. So instead of distending or moving pain, now the patient's going to say the pain is sharp, it's stabbing, and it's fixed. So they'll say the pain is fixed, it's right here, it's sharp, it's stabbing in nature, it feels worse with pressure. Sometimes they might even say it feels worse at night. If you are evaluating a woman, you might ask about their menstrual period as well. And when you ask about the color of their blood, they might say they have dark menstrual blood and clots. Depending on the size is how severe the blood stasis is. Now, when it comes to the tongue and pulse, when you look at the tongue is going to be purple, or at the very least, it's going to be dark. Maybe you might even see some spots, like spotty purple areas on the tongue. The pulse, when you palpate the pulse, you'll feel a wiry pulse or a choppy pulse. And for blood stasis, our treatment principle is going to be to move blood. So you might see this on your exam as invigorate blood. We also could dispel stasis. And of course, we want to regulate Qi so we can stop that pain. Some really common points for this would be spleen 10, which is a big blood mover. Liver 3, Ren 3 is also a very good point for this. And so before we move on to the next section, let's do a quick recap. So here's an easy way to remember Qi stagnation pain and blood stasis pain. So basically, Qi stagnation pain, it moves. Blood stasis pain, it stays or it doesn't move. So Qi stagnation, pain moves. Blood stasis, pain stays. That's an easy way to remember it. So in the next one and the last one now is cold in the lower abdomen. So with cold in the lower abdomen, this is very common, especially in women with menstrual pain, or at least it's very common in patients who are always cold. They say, I'm cold, they're wearing a lot of sweaters, and they may even be people who always prefer warm drinks, or it might be a patient who's always drinking cold things and cold has invaded their body. So cold has a contracting nature, we know that. It tightens everything up, it slows everything down, so it slows Qi down, it slows blood flow also. The constriction that it causes in our body will also cause pain, it's also going to cause cramping. So what you'll see on your exam question is like dull or deep or aching. You might also see worse with cold or worse with cold drinks or worse with cold exposure. You'll also see like better with warmth. They prefer hot packs or they prefer massage or pressure. And sometimes when you palpate their stomach is literally cold. So your patient, when you're saying, hey, how are you? How is this? You're asking the quality and nature of things. They might have some indirect things in the background that you have to pick up on. Like they say the heating pad helps me so much, or it's really bad whenever it snows, or it's really bad whenever it gets cold outside. Or they might say, if I have a nice coffee, I start to cramp up right away. It's all the cold. The cold is causing the issue. When you look at their tongue, the tongue will usually be pale. The tongue will be moist with a thick white coat. When you palpate the pulse, you'll find a deep pulse because it's cold, and also a slow pulse, again, because it's cold. You might also sometimes see a tight pulse. So for this one, our treatment principle, we want to warm things. We want to warm the channels up. We want to dispel the cold. And of course, we want to just regulate their Qi and blood overall. So this type of patient would be best for some moxibustion, and you can use moxibustion on points like Ren 4 or Ren 6, things like that. Now, something that's coming to my mind is dampness, and I know some of you may comment and say, well, what about dampness? That's very common with lower abdominal issues. And yes, that is true. So we'll talk a little bit about dampness here. So dampness, the thing with lower abdominal issues and dampness, there isn't really any pain that it directly will involve. And that's why I didn't really include it here. But what the patient will say is that they'll say, I feel heavy, I feel full, I have a sticky feeling in my mouth, I feel heavy down there, I feel like I'm carrying a weight in my stomach, I feel heavy, I feel sluggish, I feel confused, like I can't get my words out, I just feel foggy. So that's dampness. When I thought about these topics, I was thinking more from the pain perspective of it. It's an easy way to do some differential diagnosis between those three. Now with dampness though, not really pain as a presenting manifestation, but there's the heaviness, the dirtiness, and the stickiness. All right, so now the next time a patient comes into your clinic and they say, I have lower abdominal pain, don't just think about where it hurts, but think about how it hurts. So is the pain moving? Or is it staying in one place? Is it dull or is it stabbing? Is the pain better with warmth or is it worse with pressure? So those are clues that kind of can tell you whether you're looking at a Qi stagnation issue, a blood stasis issue, or a cold issue. All right, everyone. So that's today's topic on the lower abdominal pain. Thank you again for commenting on YouTube asking for this topic. Hope this episode helped you. If this episode helped you connect a few dots, share this episode with a friend, share it with another acupuncturist. And if you want to keep learning in small, consistent steps, I really encourage you to sign up for my Quick Win newsletter. You can sign up at studyacuvithme.com/quick win. So basically this Quick Win newsletter is one exam style question every single week. There's multiple choice and then you get the answer at the bottom of the email. It's a full breakdown. It only takes 5 minutes so you can study smarter, not longer. All right, everyone, until next time, God bless and happy studying.